Hello, good day. I want to thank all my returning subscribers for staying with me on YouTube, and then those that follow me on Facebook and TikTok. And I'd say thank you to everyone. There's been a massive support in just these 2 days that I've made some of this my posts or my videos. And then to new subscribers I have on YouTube, yeah, welcome to the channel. And on TikTok, welcome as well. Facebook, you are all welcome. Okay, today I will be talking about a health issue or health challenge that is called inflammatory disorders of the spine. Yeah, this is something I'm currently battling with. And so I decided to make a video and talk about it and enlighten people about it too. Because maybe 1 or 2% might be out there that is passing through it but doesn't know that that is what they are going through. Okay, this I actually got this health challenge after giving birth to my child in 2020, my first child, my son. That was when I got affected by it, of which I didn't know that that was what I was having. Because immediately after, within a year of giving birth to my first son, I also got pregnant with my daughter. So while I was nursing my child, I was having a very severe back pain, and I felt it was something that was happening because I just gave birth, and so my I'm yet to heal properly. So I hardly then I was not able to do anything that would require me bending down or even standing for a very long time. I couldn't do it. So when I got pregnant with my second daughter, it became worse. The back pain coupled with the second pregnancy and the weight of the second pregnancy still resting at the same back and waist made it more difficult. So after I gave birth to my daughter, I started going for normal regular checkups and on each checkups. And the thing is that after I gave birth to my daughter, I also had another issue. I also uh, had a complication that resulted to another health challenge. But that I'll talk about that in another video. The health challenge was you can either call it a vaginal scarring or you call it a vulvar scarring. So I actually got that health challenge too, but that will be a case for another time. But today I'm just talking about this inflammatory disorders of the spine. So when I started going for my regular checkup, my gynecologist will always prescribe medication that's diclofenac and ibuprofen, dipirona, any pain relief medication. I was always placed on pain relief, but I was taking them and they were not working for me. Nothing was happening. So at a point he had to write an injection for me. I took the injection, but it didn't help me. So I started making research about the this particular back pain. And when I was making my researches in some blogs online, I wasn't getting any information that was very healthy or kind of very accurate for me to use or work on. So in blogs that has women that have given birth as the group, whatever, was always complaining that they've been with back pain for at least for 5 years, for 10 years, for 15, some for 20 years. I was kind of surprised. I was shocked to an extent to hear that there are some people that are battling such case. So at a point, I gave up and started managing myself and then said, this is what comes with pregnancy and giving birth. I hear so many people lose their sight, some lose their hair, so many things and the rest. So initially, I was thinking it was because and most of the times when I complain to the people I'm here with, they will tell me that those that they've seen that always have back pain are those that give birth through CS. Anybody I complain to tell me that will first of all ask me, Sandra, did you give birth through surgery? I would say no, it was a normal birth that I had, a vaginal birth. So they were like, okay. Then did I have this anesthesia that they give at the back at the spine? I said yes. Then they will not say, maybe that is the reason why that there are some people that do have that anesthesia and it will kind of not it will be result to something else for them. So I gave up and I was thinking that that was actually what was happening to me because of the anesthesia and all those things. Oh, I kept on going to the clinic, and at a point, the last clinic I went to, my gynecologist was like, "Is this still disturbing you?" I told him yes, and then he was like, "Okay." Even after the injection, I said yes. So he now had to refer me to an orthopedic doctor. So I had to book an appointment with an orthopedic doctor. When I got to the doctor asked me if the the pain was affecting my legs. I was like, no, but the pain is always affecting my back. Some days it's at the lower part of my back, some days it's at the middle, some days it will be at the upper parts of my back. That's the neck and the shoulder. So he was like, yes, that's how it goes. It can move around. And then he told me that the lower one back pain is called columbar spine, whatever, and then the upper side is referred to as the lumbar part of the spine. So, and then I was referred for a scan. So they were like, which one is the most, I'll be the most painful one? I said the lower back. That whenever it happens at the lower back, it's more severe and unbearable. So I was sent for a scan. The scan result came out, and funny enough, I the scan was okay. So the doctor was like, it's not possible. It can't be. So after some discussions with him, he then told me that I was having what we call inflammatory disorder of the spine. It's like my spine is swollen. Uh, the muscles around my spine, my spinal cord is swollen. So that is what is causing it. Wow. I was shocked because I've never heard about anything of that nature, you understand? So what he did was that he prescribed a medication, a particular drug for me that I was supposed to take for some while. Then he said and then I was also booked for physiotherapy. But the thing is that this physiotherapy, I've not started taking it because I'm still in line. There are so many other persons. I'm waiting to get a call. So this medication, I took it, I was prescribed 3 packs of it, but I first of all took the first pack. Then after taking the first pack, I was like, okay, I'm gonna try and not take the remaining 2 packs of it and see what will happen. So after taking this first pack from at the early October, I now left it. Funny enough, as of Thursday, I woke up early in the morning to dress my kids for school. Lo and behold, I couldn't even stand up from my bed. It was so severe. My whole back was so stiff, and all through, I've battled with this thing for over 3 years and now. And the worst is that when it was happening before I got this medication, I don't lay with my back, I don't lay with my tummy on the bed. I have to lie sideways like somebody that is pregnant. So you know that a woman that is pregnant doesn't lie with her back or her tummy. It's always sideways. You like sideways. So that was eventually what how I was lying down. So that was what happened to me on Thursday, and I couldn't stand up. I couldn't. And when this happens, I don't sit down. I can't sit down. I can't. When I'm standing, I can't stand more than 10 minutes. I can't bend down. Anything that will make me bend down, I can't do it. That is how severe the thing is. But all this for the past 3 years, I've been managing it until now that I got it. And this is the medication that I was given. I don't know if you are seeing it. That's the medication. That's the name. Is a is a combination of paracetamol and another drug, codeine. Yeah, it's for muscle relax. They are called muscle relaxants. So this was the medication I was given. I take it once every 8 hours. That's it. Oh, please, I'm sorry, but this video is going to be a bit longer than the other ones because I'm going to talk about the health issue, and the sickness in length. So that medication that I showed you was is what I'm taking presently. Why still waiting for the physiotherapy? So according to the orthopedic doctor, he's like, if I'm done with this medication and the physiotherapy and there's nothing more left, then I will come back. And I think the only option will not be to do a surgery, but he didn't tell me. I had to go and browse it to find out everything about this thing. So what the truth is that a lot of women are going through it and they don't even know what to do about it. One of the occasions when I was browsing or surfing through the internet, I there's this lady I follow, there's a business lady, Fab Jewels, that's the wife of Yumi Casual, the brother of AY. When I saw where she made a post of her having a back pain, going to her doctor, and her doctor telling her that she should go for physiotherapy, that she should be going for this physiotherapy stuff for the meantime. Let's see how the thing goes. So when I saw her, I was like, oh, I'm not the only person battling it, and I kind of started giving up my hope. My husband was the one that was like, even if there is no cure, there should be something that somebody can be taking to manage this health condition. You can't tell me that it's just like that. I was like, I don't know now. See now, even people like this are also complaining. So what do you expect, or what do you want me to do? Before I now got this, before I now happened to get to the orthopedic doctor. Now, for the sickness in particular, it is called inflammatory disorders of the spine and can be caused by a wide range of conditions, including arthritis, osteoporosis, and infection. The inflammation of the spine is rare. It's a very rare sickness, but can be significant source of pain and disability, especially if this hard to diagnose conditions go untreated. Yeah, you can imagine me now. I stayed over 3 years before I was able to even find out what was happening to me or something, what was going on with me. Okay, now the symptoms that you can use and know that this is is going on into that is this: patients with spinal inflammation will experience what we call back pain in some form. Then those with infections, for example, may experience a slow onset of severe back pain accompanied by fever, chills, and fatigue. That's tiredness. Then patients with what we call ankylosing spondylitis experience slow onset pain as well, but it may come and go. That's the difference in the two. And then the diagnosis of it is how you can diagnose this sickness is just very simple. Diagnosis of inflammatory disorders of the spine often begins with a full physical examination and blood tests that can identify an infection or detect the presence of inflammation. X-rays also are used to visualize the changes in the spine and identify bony growth. Then finally, patients with ankylosing spondylitis may undergo genetic testing. A certain gene that is referred to as HLA-B27 is being found to be present in almost 90% of patients with the sickness. Then the treatment for it is the depending on the cause of the inflammation. Now that the treatment of the inflammatory disorder of the spine varies depending on the cause of the inflammation. Like in my own case, there are some that are caused by infection. There are some that are caused by, my own was caused by childbirth, and then there are some also that are caused by different other things. Now for those that are caused by infection, um, you can treat it with antibiotics, rest, and what we call a brace may be used. Then in patients with ankylosing spondylitis, anti-inflammatory medications and muscle relaxants, which is this medication now that I'm using. So my own case in particular is this is this ankylosing spondylitis. That's what my own case is. You understand? Is not the infection. Oh, my own case came because of the childbirth. So you are being treated with anti-inflammatory medications, muscle relaxants, often given to control the pain so patients can exercise and improve posture. Then in some cases, surgery may be necessary. So that is just basically everything about this inflammation disorder of the spine. So that is it. Please, I will really encourage everyone that is seeing this video and listening to it. Please, I would love you all to share the video, especially to a group that all these maternity groups or motherhood groups that a lot of people do complain of having back pain like mine, that have battled with it for a very long time without any without any form of relief. Please do share it so that we'll know if it can be helpful for them. Uh, yeah, at least it can be helpful for them to them. Like this medication, for those in Nigeria, I don't know if this medication is in Nigeria in particular. I don't know at all if it is in Nigeria. This is it. I'm bringing it up closer. At least people can say it. And being it has it's this is it. This is how the pack is here in Brazil. And then inside it is like this. It's, I think it's how many capsule inside it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's 12 capsules inside it. Or 12 tablets, sorry, inside it. So I do take my one tablet every 8 hours. One of the occasions, let me just tell you what happened to me recently. One of the occasions, I took the medication within 6 hours, not 8 hours different. And I almost died in my house. That's the honest truth. I almost died in my house. I couldn't see. My heart was seizing. Like my heart automatically ceased. Like for over 30 minutes, I had to stay at a particular place and I was alone. Nobody was at home. My husband wasn't around. I was just alone with the kids. That's after 30 minutes, that was when I started regaining myself. So when you're taking this type of medication, you need to be very careful to avoid any type of stories. So please, before you take it, make sure you meet a doctor. In Nigeria, it might not be this, but I think there should be something else that is close to this there. Even here in Brazil, when the doctor prescribed the medication for me, he told me that I will not find it in the clinics, like the pharmacies inside the hospitals, that I had to go and buy it outside. So when I went to buy it outside, they refused giving it to me self until I showed them the doctor's prescription paper. They were like, okay, that is they were just very, the pharmacist that is living within my area, because he knows me very well. He was like, are you sure you're the one taking this? And I was like, yes, I'm the one taking it. You understand? That was when he gave it to me. So this is what I've been using to manage mine. Whenever I don't take it, the pain come back. That's why I had to do that experiment of not taking the other packs when I finished one pack of it, to know if it's something that this pack will just, it's something that will just go away after taking the medication. But I found out it's not. Once I stopped taking the medication, and I guess that is why I was also referred to for physical therapy. So this is basically everything about it, and I'll encourage you all to watch this video to the end. Please share it, tag people that you know needs to listen to the video and be tagged. They say ignorance is the highest thing that kills people on earth. So when you're aware of what you're passing through, at least you know how to navigate it to stay alive. It's a very sad thing for a mother to die after childbirth, leaving her children behind. So that is why I decided to make a video about this and enlighten people about it. Thank you all very much for staying with me and listening to me. God bless you all, and do have a very nice week ahead of you. Thank you and bye. Till we meet again. My next video, I'll be telling you about how I gave birth that resulted to this issue, and also how I gave birth to my second child that also resulted to another health challenge. Thank you. God bless you all. Love you all. Bye.